Tuangazie taarifa zingine ambazo zimegonga vichwa vya habari. Idadi ya madaktari wanaougua virusi vya korona nchini kwa sasa, mtazamaji, imeongezeka, huku madaktari 10 wakiwa katika hali mbaya. Kulingana na chama cha madaktari cha KMPDU, kuna upungufu mkubwa wa wataalamu wa wahudumu kwenye vyumba vya ICU, huku akisema orodha ya wagonjwa wanaohitaji huduma za ICU inaendelea kuwa ndefu. Aidha, KMPDU inasema itaanzisha kampeni ya kuhamasisha wanachama wake kupokea chanjo ya korona ili kuzuia hali inayoshuhudiwa mwaka jana ya maafa mengi miongoni mwa madaktari katika bara Uropa. Kauli ya KMPDU imetolewa wakati kiwango cha maambukizi nchini kimefikia 22%.
COVID-19 vaccination, and it was to be in 3 phases: phase 1 for health workers, phase 2 for elderly and vulnerable population, and phase 3 for the other populations. We encourage everyone to get the vaccine. Members of the divisions of KMA Mashinani have asked for equity in vaccine distribution. They want the vaccines distributed also to the counties so that we do not concentrate only in Nairobi. On the issue of vaccine hesitancy, I think the association has given information, and this has reduced significantly. And as you know, many of the health workers are actually receiving the COVID vaccine. And we assure Kenyans that it is very important to receive the vaccine, because it is the vaccination that will help us in future open up the economy. On the measures of COVID-19, we continue to urge the public to adhere to the prevention measures of washing hands with soap and water, sanitizing, wearing face masks, physical distancing. The school holiday indeed is a welcome reprieve, as it will minimize some of the transmission that we have seen. But we encourage the children going back to their homes to prevent transmission, because we know they are going back to vulnerable populations like their parents and grandparents. Our recommendations are that COVID-19 testing capacity be increased and be availed for free. We also urge for an enhanced range of testing, availing what are called antigen tests to supplement the PCR tests. We ask for a rapid vaccination approach. Actually, we would like that all people who are able to be vaccinated to get the vaccine. And we also, as the association, are training health workers on how to manage COVID. And we have gone to all counties. And we hope that the training of health workers will encourage mitigation measures for COVID-19.
Thank the government for having secured the vaccine doses under the COVAX facility. Kenya is amongst the one of the few countries in the global south that is a recipient of this vaccine. We support the vaccine rollout as KMPDU, and we will work closely with the Ministry of Health moving forward on this matter of vaccine uptake, because the reality is that there's been vaccine hesitancy and low uptake. And this is because there was no involvement of the healthcare workers' unions, associations before the rollout, and also lack of adequate communication, sensitization, and awareness on the COVID vaccine. In as much as healthcare workers understand the vaccine, let us also remember that we've had a very long period of vaccine misconception. So it is important that we engage the healthcare workers even as we continue the vaccination. The vaccine will be critical, more so in this frontline healthcare workforce, to reduce the risk of contracting severe COVID disease. And we all know the outcomes of severe COVID disease. We do not want to be in a scenario where we lose doctors as we lost last year because of contracting severe COVID disease. So on that note, we shall work. We shall actually embark on our own campaign as KMPDU to work and to engage our members to take up the vaccine and get vaccinated. And lastly, we'd like to urge the members of the public and the political leadership of the country to strictly adhere to the COVID-19 preventive measures and protocols. The more members of the public get sick, the more the system is constrained in response. And just to finish by saying that we don't want to see ourselves in a situation that we saw last year in Europe. Because do not take lightly the fact that there is no ICU space, the fact that isolation wards are getting full in record days. That would mean that most will lack access to healthcare. So as a country, there is need to quickly converge a multi-stakeholder forum and engagement. We know there is the COVID response at the government level, but at this point, it is important that we all come together and see how we chart the way forward on this COVID situation.
Bila shaka mtazamaji, chama cha madaktari kikisema kwamba maeneo ya karantini yamefurika kwa sasa na kwamba hakuna vitanda vya ICU, jambo ambalo basi ni la kuhuzunisha wakati ambapo wimbi la 3 la virusi vya corona linazidi kung'ata na hata bila huruma. Hivyo basi unakumbusha kwamba kila wakati valia barakoa, hakikisha kwamba unanawa mikono yako kila mara na sabuni mtazamaji, na vile vile weka umbali, kaa mbali na mwenzako angalau kwa mita 1.5 kuhakikisha kwamba basi tunapambana na msambao wa virusi